Hi, this is Dr. Eric Codner with Southwest Georgia Center of Medicine in Americus, Georgia, and Columbus Physical Medical Center in Columbus, Georgia. One of our frequent questions is how is our stem cell therapy different from other stem cell therapies? And first of all, let me say this. We do not do classic stem cell therapy, and that may come as a shock to you. But we don't, and simply because under current regulations, the FDA ties the hands of doctors and clinics that want to do stem cell therapy the way it's done over in Europe, which is very, very successful. Stem cell therapy is not that new. First of all, that'll probably shock you too. Europe's been doing it for over 50 years now. Sports stars have been going to Europe to get this done for decades. And only here in the U.S. has it, I hate to use the term suppressed, but I feel that it has been suppressed because stem cell therapy actually heals the body. It fixes the problem. If you fix the problem, what don't you need? Well, you probably won't need your drugs or less of them. So pharmaceutical companies probably wouldn't like stem cell. You're probably not going to need a surgery anymore since you've healed the problem. You may not need the surgeon. So you can see those two things right there. There's some pushback against stem cell therapy. So when I say we don't do classic stem cell therapy, well, what do we do? Well, we use placental tissue allografts. And not just placental tissue, we also use cord blood and amnion tissue allografts as well. And what that means, all that old Latin I'm speaking here, is literally a tissue transplant from donated placental tissue. Now let me define all that. The placenta is the bag, the sac the baby grows in the mother, and after the baby is delivered, used to they would just throw all that away, the placenta, the cord, throw it all away. Now they realize, hey, this is a gold mine of nutrients, of stem cell, of exomes, of chemicals that can help regrow your body. And the beautiful thing about the cord blood and about the amnion tissue is that it's what they call immune privileged, meaning it's invisible to the immune system. The immune system automatically thinks it's friendly. We're part of Stem Cell Institute of America. They're the biggest body of clinics who use this placental tissue allograft to treat degenerative joint conditions and other health problems. And with over 500,000 injections, there has not been one documented side effect from the placental tissue allograft itself. So how does it stack up to other stem cell therapies? People go and they get the fat derived, they get their own fat sucked out, kind of with a mini liposuction session, and the fat is processed somehow, and they inject that back into you, and those are your stem cells from your fat. Or maybe through the bone marrow, they punch a hole into your hip bone or femur, pull out some bone marrow tissue, and use those stem cells to try to do the same thing that we're doing. Here's the problem with that. Your stem cells are just as old as you are. That means they've been around. So let's say you're 60 years old. Your stem cells have been making if they're coming from your bone marrow, they've been making blood for the past 60 years. They don't want to turn around and make, let's say your knee's bad, you want to regrow your knee cartilage. Those stem cells from your hip bone or your fat, they don't want to make cartilage in your knee. They've only been making blood and whatever they've been making for the last 6 years. It sure as heck hadn't been knee cartilage. So the thing is, they're not going to just because I'm in a knee, I'm going to start making new knee cartilage. They want to continue making what they've been making. Contrasted to the placenta has just made a newborn baby. That's all it's been doing for the past 9 months. That baby needs a little bit of everything: organs, tissue, blood, all that stuff. Those stem cells are primordial, meaning they're more apt to be able to make anything because they just had to make a baby. And they're only 9 months old. They're not old and tired like your stem cells are in your body. So these stem cells are just more potent in the placental tissue allograft. And notice I keep saying placental tissue allograft because the FDA has no problem calling it that. I just can't call it stem cell therapy. So the tissue placental allograft does have millions of stem cells in it, obviously, and that is what makes it so effective, because you are getting those stem cells. They are repairing your tissues. But with that, you're also getting cytokines, you're also getting exomes, you're also getting other nutrients and building blocks and scaffolding that's necessary to rebuild your joint, whether it be your knees, your hip, your shoulder, maybe your spine. You need all that more than just stem cell to make that happen. It's just like putting some contractors on the ground with no lumber, no cement, no nails, and telling them, hey, build a house. Well, they know how. The stem cells know how to rebuild you, but if you don't give them the right materials, what are they going to build with? And so that's another big reason why we use the placental tissue allograft type of therapy versus what the FDA allows to be called stem cell therapy. Now, like I say, it's very different over in Europe. They can take the bone marrow, the fat, add chemicals to it, add enzymes to it, add all the things we just talked about to it, and then make a good product that works. That's why the sports stars and movie stars went there and still do go there. Here in the U.S., we can't do that. The FDA says you take it from the fat, you got to put it back in within a couple of hours. Same thing with the bone marrow. It's very strict. The placental tissue allograft, a lab is able to process this properly, and then we purchase it and then are able to deliver it. Once again, we've had no side effects with this type of therapy. It has a roughly an 80% success rate. We have seen upwards of a 1/4 inch of cartilage regrown in certain joints. It's amazing. It's like a medical miracle, and I personally believe it's going to revolutionize medicine. It's already started. The stem cell revolution has already began. You're going to see different movies and things on the news and television about it soon, and you can take advantage of it now, though, before it becomes popular. I can't imagine the demand going down. Then it's probably going to go up. Supplies may become scarce. So, if you want to talk to us about it, see if you're a good candidate. Not everyone's a good candidate for it. There are certainly some exclusions, and it is not 100%. So give us a call if you want to talk about it. If you have any back trouble, knee, shoulder, hip trouble, wrists, ankles too. I mean, it can help in pretty much any joint. So give us a call if you're near Americus, 229-389-2038. If you're near Columbus, 706-330-1389. We're definitely going to be updating if you want to see more information, more videos about stem cell therapy and placental tissue allograft therapy, the pros, the cons, the good, the bad, the ugly, where you can find that on our website, and we'll be sending you more things through email or through the website soon. So until next time, this is Dr. Eric Codner. Thank you.